Okay, hello and welcome to you all. Em, I'm checking you've pressed the start button for this. Yes. Okay. So hello all. Thanks for being part of this webinar today. We've got a range of people attending, including staff from the Mental Health Council of TAS, various organisations, some members of our steering committee, our researchers obviously, who we'll introduce in a moment. For those that haven't met me before, I'm Laura. I'm the project coordinator or campaign coordinator. We're really excited to talk to you about the interim evaluation. It's a real milestone for the campaign. It's great to be able to share the results with you. So if everyone can have their microphones on mute, and there'll be an opportunity to ask questions at the end of the session via the chat function, and Em and Amanda will help us out with that. We'll begin with an acknowledgement of country. We acknowledge and pay deep respect to the Palawa people of Lutruwita as the traditional and original owners and continuing custodians of the land, sea and waterways upon which we live and work. We'd like to pay our respects to elders past and present, and we'd like to extend our respect and acknowledgement to any Aboriginal and Torres Strait Islander people who might be joining us today. So we've got about an hour for the webinar today. We've got Dr. Joop van Agteren and Dr. Matthew Isiello with us from the South Australian Health and Medical Research Institute. So welcome both of you. I will start the webinar with a bit of an introduction to the campaign, talking about the background and development, and then I'll hand over to Dr. Matt and Dr. Joop, our researchers, to talk obviously about the interim evaluation results. Then we'll pop back to me and we'll cover where to from here for the campaign. And then we'll have an opportunity for you to ask questions, whether that's for our researchers or for the campaign team. Right, okay, let's go to our first slide. So Take a Minute is a mental health and wellbeing literacy campaign. What does mental health and wellbeing literacy actually mean? Well, this is a long definition, but it's really comprehensive. So it's the knowledge, understanding and skills needed to promote mental health and the capability to comprehend and compose language around wellbeing, which ultimately serves to help improve the wellbeing of individuals and reduce the impact of mental illness. So it's a mix of knowledge, understanding, skills, and the ability to understand and compose language around wellbeing. So with this campaign, we want to raise mental wellbeing literacy in Tasmania. It's a whole of population and strengths-based campaign with a targeted approach at the community level. Now, it's a new approach. We're focusing on promotion, prevention and early action to maintain mental wellness. So it's different to traditional mental health campaigns, which often focus on the negative signs and symptoms of mental illness and when things obviously aren't going well. Take a Minute flips the script. So it's focusing on a very different end of the spectrum. It's focusing on promotion and prevention. It's a very positive campaign where we're wanting to use consistent language. We want to decrease stigma and increase positive conversations around mental health. It's also unique because we're inviting participants to identify the strengths and resources that they already have in their lives. So we're not telling them what to do, to be more mindful or to eat more healthily or be more active. Obviously, those are important aspects for mental health, and Take a Minute can sit alongside other programs. But this campaign is really about helping people identify what resources they already have in their lives to boost their mental wellbeing and making a conscious connection between these things, some of these things, and the benefits to them. So here's a clip from our website with an overview of the campaign.
Take a Minute empowers Tasmanians to take charge of their mental health and well-being. It asks us to consider the simple things that we can, and often already do, to stay on top of and boost our mental well-being. It's about understanding what good mental health and well-being looks like and the positive ways we can achieve it. Find out more at takeaminute.com.au.
So for the campaign, we've partnered with the South Australian Health and Medical Research Institute, or SAMRI, much easier to say, researchers Dr. Matt and Dr. Yoop. Now, both of these are experts in research, mental health literacy and behaviour change. The behaviour change aspect was really important to us when we put out an EOI and made the selection of the researchers that we wanted to work with. Health promotion campaigns don't always incorporate an aspect of behavioural change into the campaign, and it really is important to address that. It's all well to know, to have the knowledge about what needs to be done to make improvements to your health, but without that behavioural change aspect and understanding of behavioural change, it's just a lot more effective when you do address that. So the campaign is backed by a really strong evidence base, and obviously SAMRI have conducted our interim evaluation, and they will be conducting another evaluation later in 2024, and that will be our final evaluation. Here are our initial campaign partners who registered and partnered with us late last year after we launched the campaign to run the campaign in their organisations. So that was with their members, their communities, might be with their staff. So what we did is we gathered data from these organisations on how the campaign, how it was run in their organisation, the positives, any issues they might have had, and use that data to inform the evaluation. So we'll continue as the campaign progresses to form new partnerships with organisations to run the campaign. So another really unique aspect of this campaign is our community capacity building project officers. We've got Amanda in the north, who's online with us today, John in the south, who couldn't unfortunately be with us today, and these guys are our statewide boots on the ground. So a key aspect for us for this campaign was really prioritising face-to-face stakeholder engagement. It's a very personal approach. Obviously, we're in contact with our stakeholders via phone and Teams and email, but that face-to-face personal approach was really important for us. And as a result, we've had really high stakeholder engagement, and Matt and you, or Matt will talk about that further down in the session. We've had well over 230 stakeholders engage with the program, and that's also testament to Amanda and John's really hard work getting out and about into the community with really positive engagement methods. So that's been really rewarding to see that building gradually and gaining information from the community around what type of approaches work well and what sort of is needed in this mental wellbeing literacy area. So mentally well, what does that actually mean? It's a term used a lot, mental wellbeing, and research has identified the most commonly reported influences used to determine if someone is actually experiencing positive mental wellbeing. And there's quite a lot of elements or domains to this, and they include happiness, life satisfaction, a sense of purpose, autonomy, sense of calm, the ability to manage problems, resilience, self-development. It's quite a comprehensive list of all of the different elements. And looking at this big list, rather than trying to use every single one of these elements and incorporate those into a campaign activity, our researchers identified 6 out of this list that are tangible and that are under the control of the individual. And being under the control of an individual has really positive benefits for levels of motivation and also ability to make changes. So 6 out of this list were identified and incorporated into an activity called the 7-minute challenge, which is a centrepiece of the Take a Minute campaign. So we'll play a clip from our website that will give you information about how the 7-minute challenge works.
The 7-minute challenge is designed to help you discover what makes you happy and fulfills your life. It guides you through an easy process, allowing you to make the connection between simple pleasures and their positive benefits. It really only takes a minute a day. You can complete the challenge solo, in a group, in an organisation or workplace. Each day for 6 days, you'll be asked to take a minute to reflect on the things, people and places that are important to you. On day 7, you'll create your own pause, drawing inspiration from your 6 answers to see what you can do more of to improve the way you feel every day. Find out more at takeaminute.com.au.
So as the clip explained, each day for 6 days, participants are asked to take a minute to identify and reflect on the things, the activities, the people and places that are important to them. And then on day 7, participants create their own pause statement, which draws inspiration from their previous 6 answers to see what they can do more of to improve the way they feel every day. So it's a really simple and achievable activity that takes a relatively short amount of time, and it's, as we said, it's identifying and focusing existing strengths and resources in a person's life and tapping into those and making a conscious connection between these activities, resources, and the positive effects that they have on a person's mental health, and then a conscious decision to use these resources, to tap into these resources more often. So I'm going to hand over to Dr. Matt to talk about the campaign design and the interim evaluation results. So Matt, I've got your slides here. You'll just guide me as to when to change to the next one.
No worries. Thanks, Laura. Dr. Matt. I like it. Makes me sound like a talk show host or something.
Yeah.
So hi, everyone. Looking at the list, I think I've met a lot of people here today, but hi to anyone we haven't met. So my name is Matthew Icello. I work with UP at a place called SAMRI, and you can see a little picture of the SAMRI in the photo there. Laura said that it's shorter than South Australian Health and Medical Research Institute, and in SA, people mostly call it the cheese grater, which actually is a longer name than SAMRI now that I think about it. But basically what's, we've been really, really excited to be a part of this project for many of the reasons that Laura already outlined, just how new it is and kind of against the grain of what's often done in this space. So it's been a really interesting challenge. Really what we do, we're a part of an organization called the Be Well Co. I'll let Yoop introduce himself. But basically we for the past sort of 8 or 9 years have been translating the scientific evidence from around the world and trying to turn that into real world training programs and policies and things like that. So we've developed something called the Be Well Plan, which is a wellbeing program that we deliver. And we've done a lot of policy and program evaluation as well. So Yoop, if you'd like to introduce yourself.
Hi all. My name is Joep van Achteren. I co-lead Biwelco together with an amazing human being called Monique Newbury, and I've had the pleasure of working together with Matt and with the team to really try and take some of the concepts that are being mentioned within the developing scientific literature and try and apply them into something tangible for community to kind of to get around. So what I hope you're going to be getting from the presentation over the next 20 minutes is to explain to you how something that looks quite simple and easy to do has quite a lot of rationale behind it. So Matt will kind of guide you through it, and I'll chime in wherever I feel there might be an extra point to be made.
Right. And next slide, please, Laura. And just like you've said, I think we've seen a really simple variation, expression of what the sort of 7-minute challenge has become, and it is quite a simple thing. But a lot of work has gone into the process of basically making it simple. A lot of work with a variety of stakeholders across Tasmania, obviously with the council as well. And so what we sort of started with, this is some people, I think, when they hear evaluation, they think of just like, measuring, did this thing make a difference? There's a really different approach to evaluation that we take, because it's mostly about sort of the design and being there from the very beginning, which has been another great luxury. Often evaluators are brought in right at the very end to say, tell us what we did right and wrong. Whereas I think we've been here from the very beginning to help actually work together on the design of the program. And the first stage of that was what's called the needs analysis. So we did a review of the academic literature, but also sort of various reports and a lot of consultation with stakeholders across the state to really understand what is the need, what is the problem that this campaign is trying to address. Sometimes it's often the case that people come up with the solution before they've even got a very clear idea of what the problem is. And we were quite pleased, I guess, to have that breathing room to sort of sit down and really clarify what do we mean. And so that needs analysis, I'm not sure, Laura, if you're able to take sort of 2 steps to your left by any chance. I don't know if that helps you get out the way of the dot points or not, but that's okay.
How's that?
Slightly useful, yeah. Thank you. Or now you've gone into Shadowland or something. But anyway, I can sort of read around your head. But what we first realized, I guess, is there is this need for more of a focus, for more than the focus of simply addressing mental illness. And we know that, of course, that's an important end that does need more attention. But there's this big gap, which is the promotion of mental well-being. And so that's where I guess this need for wellbeing literacy came through in the literature, but also in the community. This idea of helping individuals understand what wellbeing means to them, and helping them to recognize the activities and behaviors that are associated with wellbeing for them. We also wanted to have an acknowledgement of, capacity and locus of control. There's nothing worse than being given advice about, or just go to that really expensive gym. It's easy. Well, easy if you can afford it, So we wanted to really have real world kind of perspectives taken into account. With that focus on behavior change, like Laura mentioned, we recognize the need for motivation and action, that this should be something that evokes kind of curiosity and something that people want to get involved in and maybe leads to more action in the future. And also this need for individual and community action. So this is not, us, quote unquote experts parachuting into a place and telling people how to do it. This actually has to be from the ground up.
Maybe one final thing to kind of add to this whole narrative. What kind of underpins this, which is a bit silent within the slide, is that there's a deliberate move within general mental health research and policy and practice to start seeing well-being and the promotion of well-being as split from the focus of treating or preventing illness. And the lens that we've taken throughout this campaign is to actually emphasize that need for mental health or well-being promotion as its own important vehicle, and it allows us to kind of start thinking about mental health in a bit more of an investment capacity building mindset rather than a deficit risk mindset. So there's a big emphasis on empowerment and agency throughout it, to ensure that people can kind of fill in their own preferred mechanisms, but also for people to start realizing that, mental health is not just something we want to avoid or need to be afraid of. It's really about something that we need to be continuously investing in.
Beautiful. Next slide, please, Laura. So throughout the needs analysis and throughout the engagement that we did in, I guess it was Southern Tasmania, the first trip was, what won't work. There was some obvious ones, but then there were some really useful ones as well. The first one, I guess, is this idea that one size fits all message just isn't useful. If we think of some of the key imagery that's used when people are talking about sort of well-being, wellness, like our picture here of sort of the yoga class and, everyone's skinny and they all look like models, that's not what a lot of the world looks like. And it's actually not what a lot of the world is interested in. Good luck getting a bunch of people to go and do yoga, let alone recording themselves there. But that just isn't what we want to be doing. And we know that it doesn't work when it comes to something like well-being. It's more complicated than, trying to get people to do 10,000 steps where you can give a kind of a general message. Well-being is defined individually. And so we had to come up with a message that allowed people to bring their own definitions of well-being and what that looks like to them into the picture and into the campaign. A little bit like what I mentioned before, this sort of top-down messaging of, here's how to do it, isn't going to work. It's about giving agency, I guess, which is the flip of the next dot point, just coming in and telling people what to do for their well-being. We recognize that that's just not effective as a strategy. And finally, sort of using boring engagement methods. So we really wanted to come up with something that, again, like I said before, evokes curiosity, helps people to get sort of inherently interested in participating. And so what are we proposing? It was to sort of meet people where they are. So we recognize that there's lots of different subcultures and locations where people act very differently. That's true of any state, but particularly by the sounds of it across Tasmania, this idea that, in some places, the central focus of meeting place is very different. And people act differently across the different, communities. And so we wanted to have something that was flexible enough that could be applied basically with us using sort of similar language, but letting people bring their own answers to the campaign. I think there was one comment in the chat just about some feedback that the slides are being partly obscured by your lovely face. That's from Emily. Not sure what to do about that, but
Laura, maybe is there a possibility for you to, while this part of the presentation goes, for you to move out of the camera, and then I will kind of bring you back in.
Yeah, you might even just be able to turn off your camera. I don't know if that will take the whole thing down, but
How's that?
perfect,
Yeah.
perfect. And next slide, please, as well.
Rightio. Oh, this
While we're bossing you around.
challenges. Now, hang on, I've got to find out how to. Oh,
Yeah,
how's that?
Beautiful. And so
Beautiful.
all of that, sort of the design process basically led us with some key considerations, which was we want equitable access. So there was a lot, as we talk through a little bit, a lot of it is focused on self-reflection, particularly by using your phone to look through some photos that you might have taken or to go out and proactively take photos. So we wanted to make sure that this was something that didn't rely on technology, even if that was the sort of the main driver. We wanted to recognize that Tasmanians are local. So we wanted this, again, to be very flexible and community driven. This notion of mental health by stealth. So, the stigma around mental health is obviously an issue that many people will recognize. But what we wanted to avoid was this being seen as a mental health thing, basically, because we recognize that in terms of engagement, that can just switch people off from the first minute. So this idea of mental health by stealth was really one that said, can we get people working on their mental health without necessarily bringing that language into the program. And you will have seen, I guess, from a lot of the language so far that you've seen from some of the videos, we don't obviously, it's not about deception. We do talk about mental health and well-being in the videos, but it's not the key sort of driver. And the last one, like I say, is empowerment. So we really wanted to bring attention to that idea that when we're talking well-being and getting people to determine their own ideas of what well-being looks like for them, that we have to basically leave space for them to empower them to do that. Next slide, please. So the way that we've gone about sort of the design and then the intervention of the program or the campaign is using something called the intervention mapping framework, which is a sort of a best practice for designing interventions, particularly public health interventions. It follows these 6 steps that you see on the screen, starting with the needs analysis, so really determining what is the problem, and then you sort of work through the next stages. So thinking about specifically what needs to change, what is it that we're trying to change in people, how will we create change by using practical, like what are the practical applications that will come with, developing the program itself, thinking of an implementation strategy, and then determining the evaluation strategy as well. Next slide, please, Laura. So we have a very, very basic sort of flow of the campaign. We've got more complicated versions of some of the logic modeling in the interim report. But basically, the idea is that the whole program is centered around this reflection, where people are taking or reflecting on pictures they already have in their camera roll, or, there's a bunch of different variations where people have done this in a tech-free way, where people are just basically considering a few different prompts that we've given them. So what is meaningful to them? What are the relationships that are resources to their mental health? Where is their favorite place? These sorts of things. But the idea, like it was said in the video, by the time you've done sort of 6 days, the idea is that if we just said to somebody, what does well-being look like for you? That's a really hard question to answer off the bat, particularly if you've not really thought about this before, which I think most people haven't. So the idea is that by going through these 6 days of reflections, by the end of it, you can kind of summarize your answers and you've got a pretty good picture of what well-being sort of looks like to you and what some of the key places and behaviors and people are actually associated with well-being. So I guess from a sort of a boring research language, we've called that your well-being literacy statement. But that's got a nicer name, I guess, in the sort of the practical application. We've going back a step then, we've tried to frame it as a bit of a challenge. So it's something that is a bit more engaging, that people want to join. And we're aiming to have lots of different entry methods. So if you want to do this as an organization, like a workplace, whether you'd want to do that with friends and family, if you're sort of noticing it online via a champion or some sort of influencer, or you're coming directly from the mental health council or some other random sort of pathway, there's kind of, the idea is that we want to make this very, like, have basically many doors to access this campaign. The idea being that once you've developed that sort of wellbeing literacy statement, you are, as we'll get to in some of the results, a bit more attuned to some of the things that are valuable in your life, some of the things that we often take for granted. And that might set you on this path then to access further resources and sort of continue this learning pathway towards your well-being and what that looks like for you. Anything from yourself there?
No, maybe the only one thing is to just re-emphasize why we went down the picture route rather than just purely a reflection route. The one added benefit of having pictures is that it kind of surpasses the language issue. So we can keep the instructions fairly simple and then give people the ability to choose what's important to them without necessarily requiring a lot of verbal skills. So it lowers access. It's a little bit more engaging, and it overcomes a couple of the issues with generally language in general. And to counter any, as Matt said, to counter any technology issues, all of them do come in a written format. So organizations can kind of choose between both. But yeah, the fact that we used the meaningful pictures was a very deliberate deliberate call.
Yeah, absolutely. Yeah, there was a lot of forwards and backwards, I guess, amongst the team of how do we sidestep the language issue, basically. And that photography was actually one that was well supported. And so in terms of some interim outcomes, so this is I guess as part of the evaluation, a lot of the needs analysis we would probably consider as like a design outcome. So you've sort of seen some of the interim results already. But some of the interim outcomes which have come from interviews and focus groups so far from people who have participated in the Take a Minute campaign really focused on a couple of different things. And it's probably just worth mentioning that the first phase of the campaign evaluation was really to check how is this being perceived so far? Has it been considered sort of acceptable and enjoyable by people? Because that's kind of the first thing we're wanting to test. And then, as you'll see in a moment, our next steps are really now to turn our attention to sort of impact and sort of change as well. So in terms of interim outcomes, the first thing I think that's been a very strong result has been that the fact that wellbeing literacy has been highly valued in the community across with broad interest across multiple sectors. So Amanda and John, who have been out on the road, connecting with community, could be very possible, as I think a lot of probably health campaigns might have seen in the past, that there's just not that much interest in the community for whatever it is you're trying to promote. So that was kind of the first massive hurdle, I think, passed, which has been really pleasing. And I don't think it's very common to see so much interest across such a wide variety of sectors, which again speaks to that idea that we've intentionally tried to make this a very broad reaching kind of interesting campaign. In terms of implementation, so the idea is that Amanda and John are on the ground to help organizations implement the campaign. And we've learned a lot in terms of sort of timing and the resources that are needed for organizations. The role of having a local champion. So that was something that we were really intentional about from the beginning, is having someone basically model what this looks like. It's certainly the case in lots of campaigns, but particularly for this one, it helps a lot to have someone say, I'm going to show you what it looks like to do this thing. So that people can sort of follow along, and it just having someone who's energetic and driving it in the language of that place is really valuable. And the exciting thing in terms of implementation is that we've seen it delivered in a range of different ways and embedded even into existing programs. So some people who might have had a community group that meets weekly have just added this into their weekly meeting. So obviously it's we sort of promoted it as a 7-day challenge, a minute a day, or 6 minutes and a summary day. But we've designed it intentionally to be flexible, that it can fit within the ways that people meet already. So we've seen some evidence of that so far, which is great. And the last theme is really around language. So far, we've seen that it's generic enough to be tailored. Again, the idea with the local champion is that we can't speak the language that's going to resonate with everybody, but having a local champion in a setting, they can talk about this campaign in whatever way is appropriate for that organization or for that setting. So that's where a lot of the flexibility comes in. We've got this generic sort of base, which can be modified to suit the local environment. And we've definitely seen, I guess, a bit of evidence so far of this idea of sort of sidestepping stigmatizing conversations while working on well-being. So this is not being perceived as sort of a threat or something that you just sort of put your hands up and say, oh, I'm not really wanting to be part of this. But actually people are having fun and enjoying themselves while sort of tapping into some of their well-being resources. Next slide, please, Laura. In terms of some of the feedback, again, this has been focus groups and interviews. We've seen some of the sort of a preliminary ticking of the boxes of some of the things we really wanted to tick. So evidence that the challenge has been considered useful, new, and helping foster connections. And there's a few quotes there which I can quickly read from participants. So I've never been asked these questions before, but answering them and thinking about them was useful for me. And there's probably a note to what you mentioned before about this being something that looks quite simplistic. Just thinking about a couple of prompts of your favorite place and your favorite, these sorts of things. You sort of don't know what you're working on, but you're working on something which is useful by the time you get to it. Someone mentioned that it's new. It's something I've not seen before. The simplicity made me think, is this even worth doing? But actually, the more I return to look at it, yes, it's worth doing. And the last one was connection. So reflecting on our positive mental health, I also thought it brought our group closer together. And so that's something that we see, because we do a little bit of this sort of activity in a lot of the work that we do across South Australia and some other states, where people really have this experience of sort of learning more about each other just by talking about the things that are useful and meaningful to us. And so some of the sort of quantitative data that we collected, it's only in about 20 people, we saw evidence of people basically participating, which was really useful, and being satisfied with the program as well. And just a note, I guess, on the participation. So I think we've heard a few times, particularly with that idea of a champion, we've seen a little bit of evidence of some people in a group sort of sitting back and observing for the first couple of days who maybe weren't that initially interested. However, after seeing the sharing of a couple of days, wanting to get involved themselves. So, that's someone who would register only as a 3 or 4 day participation in the 7 days. And yet, so sort of quite a valuable contribution as well. Next slide, please, Laura. And yeah, this is some of the user statistics so far. There's been such a broad range of diversity when it comes to organizations that have been putting their hand up to participate, and again speaks to sort of a bit of a nod to that goal we had of making this something that works across the state. So you can see lots of different organizations have been engaged, with more than 400 people. I think it's getting closer to 600 or 700 you mentioned today, Laura, actually engaging with the 7-minute challenge, with more than 2,000 hits to the website. So again, it's not very common, I think, that the team's having psychologists, officers contacting them, and local footy clubs, and they're getting involved with local cafes and small galleries and all sorts. So that's, again, not something I think that we would commonly expect to see from something like this. And that's really it from us. Yoop, do you have any final comments before we pass it back?
No, generally, just to say that this is kind of the starting point for our evaluative journey. So the fact that we have reach within such a wide variety of organizations across the state just sets us well up for the next phase of the evaluation. So for us, it's looking forward to that. Looking forward to that now, building on these quite positive results.
Great, thank you.
Right. Thanks, Matt and Yoop. Em, is that okay? Can you see me again all right?
Yep.
Yes.
Great. All
Yep,
right.
perfect.
So next steps, where to from here for the campaign? So we'll continue to collect data for evaluation, and as Matt mentioned, there'll be a shift in focus for our next evaluation from design, testing and acceptability towards implementation and campaign reach. Amanda and John will be continuing to engage stakeholders and form new partnerships. We're applying to present at multiple conferences across Australia, across the rest of the year. And we really want to grow the campaign visibility across Tasmania. So we are, of recent times in the last month or so, we've begun a real focus on social media and engagement in that platform. We've also started a youth peer mental health and wellbeing program in Devonport, for which we're partnering with the Devonport Council. Like Take a Minute, it's the first program of its kind in Tasmania. And our aim is to equip young people in Devonport with the skills and resources to engage with their friends, family and community, to understand positive mental health and wellbeing. So we're pretty excited about this. It's aligned with the Take a Minute campaign, and the Take a Minute campaign will be utilised as a base for the Devonport campaign. So to get involved, we've obviously got John in the south and Amanda in the north, and myself as well. Contactable and welcome contact from new organisations, individuals. We also have a website, takeaminute.com.au. So that is pretty much it for the session now. We've got time to open it up to your questions. So if you do have anything you would like to find out about, if you've got a question for Matt or for Amanda or I, pop it in the chat now, and we can discuss. We've got a bit of time before the end of the session. So Em, I can't see the chat from here, and I'm a bit too nervous to change my screen in case I crash the presentation. So you'll let me know if there's any questions and read them out for us.
Absolutely. As of yet, I can't see any, but that is fine. I'm keeping an eye on it.
Okay.
And of course, if people don't feel comfortable putting their questions in the chat, please do take note of the contact details on the screen at the moment. You can absolutely ask questions at a later point.
And we welcome suggestions and constructive criticism as well. This is a new and novel approach, as we said before, and we are, as is normal, we are making mistakes and learning as we go. So we really do welcome feedback, because we're all very up to our necks in this project and have been now for a good 18 months, 2 years. It's hard to be objective and to step back. So we really do welcome suggestions and constructive criticism. Em, any questions? Because if there aren't any, we will probably wrap up the session, I think.
Yeah, we've had just quickly some feedback from Rebecca, who doesn't have some questions, but it said it was a very comprehensive presentation. And then Jane has said, part of what makes campaigns so successful, such as the Ice Bucket Challenge, is having someone spearhead the campaign. Can you please go back over what was said about champions of the campaign, as I missed it?
Yes, so the idea with this campaign is that we equip what's called community champions within a community, within an organisation, within a workplace to drive this challenge. So obviously we don't have the resources between the campaign team to be everywhere and everything to everyone. We are backstage, as it were. We're not front and centre stage delivering this campaign. Our role is to support those people in the community or in a workplace or organisation or community champions that can take this campaign on and drive it. So we're here, particularly Amanda and John, to provide support and guidance and ideas when needed to tailor the campaign to a particular community to make it appropriate language and engaging. So support obviously is what we're able to offer, but the community champions or an organisational champion are really key to the development, the delivery of this campaign, and also the sustainability as well. At present, we have funding until the end of this calendar year. obviously we hope for extension of the campaign, but we need to make sure that communities take it on and really run with it themselves. Is there anything you or Matt or Amanda that you wanted to add to that, or does that explain it fairly clearly?
Yeah, maybe one emphasis is that when we talk about using champions within organizations, our champion model relies on trying to lean into that local identity within Tasmania. So rather than considering just like one or two large champions, is really to try and build that capacity within the community. So as one of our next phases, we are trying to find ways to kind of tap into local influencers and really try and lean into them, trying to push the campaign along. Because we heard very early on that there's different regions and different aspects of society within Tasmania that lends itself well to kind of like a network of influencers and champions. And that's really what we're going to be trying to focus on building out to when we move into this next phase of trying to increase reach.
And we've got a question from Shay asking, is the evaluation to be finalised following the end of the calendar year or beyond?
Oh, that's a question for Matt and you, but obviously we'll be collecting data for the rest of this year. And Matt and you, when will that occur?
Yeah, I think I mean, all of these things are a little bit flexible, but I think what we'd at least have in mind is that we are informing a final evaluation that would be ready before the end of the year, but probably collecting data and, just basically building that it might even, the final report might be something that happens, early next year. But there'd be something like a working version available before that.
Currently, no more questions.
Okay, well, thank you everyone for coming along. Please feel free to submit questions if you think of them. Thanks, Dr. Matt and Dr. Yoop. Appreciate your time. And yeah, let us know if you've got questions or feedback. And that's pretty much it. Thanks, Em.
Thank you everyone for attending.
Thank you.
Thank you, everyone.
That was professional.